Hey, welcome to another episode of Clear Lake Connections, where we talk to the people behind the businesses of Bay Area Houston, proudly sponsored by UTMB Health. Today's special guest is Dr. Yoon with the Clear Lake Med Spa. Tell us about the Clear Lake Med Spa and kind of, I've heard it started as one thing and has kind of blossomed into this.
Yes. Good morning. Thank you guys so much for listening in. So as he mentioned, I'm Dr. Caroline Yoon, and I've been in this area I've been staying 10 years for the last 5 years, so I guess it's 15 years now. I started off with Dr. Berman, and we are ear, nose, and throat surgeons, so we're head and neck surgeons. I think people do not realize that our training teaches us to do facial plastics, to do rhinoplasties and facelifts, to do filler, to do toxin. If we can, I hate to say this, cut a face open, we can definitely do things such as that. It's quite simple. I think a lot of times people think only dermatologists do it, but we actually, as surgeons too, we're wound healing specialists, so we deal with everything in this area, from the eyes down to the clavicles. So it was very natural for us to kind of segue into a medical spa. It's a little bit different than the ENT world, but as I mentioned, we're familiar with it. I brought on a partner, Dr. Melissa Hu, and she does facial plastics, so she is subspecialized in that. So it was very, very natural to then open up a medical spa. I always like to clarify that there is a difference between a day spa and a medical spa. Day spas are great when you want to go and relax and have a facial, but a medical spa is a totally different level. We really, it allows us to do medical grade procedures, and sell medical grade products. Think of it as a deeper type of treatment. So it's not just to look rejuvenated or refreshed or to go to a relaxed setting. It's really so that we can get a good outcome. So we are treating medical problems too. I think.
What are some of the most common things that you kind of deal with in that area?
Well, we've got the skin conditions such as melasma, acne, things of that nature. Obviously, a lot of our clients come in and they want to look more youthful, they want to look refreshed, and it's going to take more than just an over-the-counter cream that they're going to want to do. We really need to get deeper into the skin, and so that allows us to do things such as microneedling, chemical peels that are deeper, not chemical peels that you're going to buy over the counter at Walgreens. These are medical grade type of products, and so it's very important to be knowledgeable on them. I always tell patients that what we use, they are weapons. If you think about it in a way, lasers are a weapon. They can absolutely do harm, so you have to be very, very familiar with it. Make sure you have proper oversight with these things too, and I do think that's probably what distinguishes us from other medical spas. For a medical spa to open, all you have to have is a doctor to sign off to be the medical director. That doesn't mean they necessarily are watching the day-to-day protocols, making sure that things are done safely, et cetera. One of us are always on site there. We oversee, Dr. Hu and I, we are control freaks, so we oversee everything. We don't just let any product come in. We don't let any procedure to be introduced until we've looked at the studies and made sure that everything that we are doing is copacetic, it's safe, and it's effective also. So I don't know if you guys heard about the disaster that happened with one of the medical spas where they were doing IV hydration, and unfortunately it ended in a disastrous result where they had a fatality. Are you familiar with that at all?
No.
It's terrible. It was a person who was obviously underqualified, who was giving just an IV. I know those have become very, very popular. She just was tired and wanted a little something. And so the person said, okay, well, maybe you're depleted and you're not eating enough bananas, and we're going to give you a little extra potassium. Well, potassium can stop the heart.
Yes, it can.
And obviously, unfortunately, it's kind of what happened in this patient too.
So your oversight is really one of the big differences.
Huge,
that
absolutely.
Makes in this case, it could have saved a life.
Absolutely.
Yeah.
We would never ever have allowed anything like that to happen. Safety is always number one. Absolutely. We want outcomes. We want patients to leave and be happy with the way their skin looks and the way their face looks, but we also don't want to hurt them either. So we're very, very adamant about making sure that we have our safety protocols in place.
Yeah, and I don't think people realize that there are, you called them weapons, but like there's medicines out there that we think are one thing, but they actually are used for multiple things. For example, my wife does Botox for migraines.
Absolutely. Toxin actually started off being used for medical reasons. For us as ENTs, we would use it, we would inject it into the neck for patients who have, I don't know if you know Diane Rehm, I don't know if you know her from NPR, but she has a condition where it has her talking like this. And so all of her muscles are contracting and preventing her from speaking. So we would inject it there. Neurologists inject it all the time for different types of conditions. And then we realized, hey, we can use this for other reasons also too. Let's get rid of the wrinkles on our face that's aging us, et cetera.
Yeah.
So they're absolutely fantastic uses for toxins. I always use the word toxin. Botox was the original toxin on the market. I think that's probably what most people are familiar with now. Now I say toxin because there are so many different ones that have been developed since then.
It's kind of how medicine works, right? Somebody stumbles onto something, and then there's I guess copycat would be a bit of a
right.
stretch,
It's like
but
Kleenex. We all say Kleenex, but Kleenex is actually the brand and not
Right.
necessarily what it is that we're all using. So, but it really, toxin has done so much for patients. We actually, in our medical spa, give it not only just to get rid of wrinkles, but we treat, for example, TMJ, patients who clench and they grind. We inject it now into one of the muscles, one of the biggest muscles of chewing, which is the masseter muscle. I do it to myself. Well, I don't do it to myself. My PA injects me too because I am really type A and I clench and I grind like crazy. And so that has given me a lot of relief. So even in the medical spa, we do it for medical reasons, not necessarily cosmetic reasons too.
So talk about some of those medical reasons, because I think, people hear med spa, you're a doctor, so you're wanting to not just, like you said, rejuvenate, but you're wanting to treat.
Absolutely. So some people come in and they want their skin to look brighter, or they don't want to have this, or they don't want to have that. Oh, I've got age spots. And we'll tell them they're not necessarily age spots. They can have a condition such as rosacea or melasma. And those are very, very challenging types of skin conditions that aren't going to go away with just doing a facial or doing microneedling. Those are important to identify. Also, cancers are something that's very important for us to identify too and make sure that it's not just an age spot. So, and then there are other conditions that I will tell them, hey, I really think I need to see you on the ENT side also too. This is something that may require antibiotics or some type of other topical medical therapy. So that it is important for people to identify what can be done within the realm of the med spa, what does require me putting on my MD hat and treating those conditions as more of something that needs to be treated on the medical side. And so that's the beauty too, is that we are all in the same building. So I literally will just put them in as a new patient, give them the paperwork, and then I'll see them on the opposite side if I need to.
So you'll actually go to the other physical office?
Yeah, I mean, there are definitely times that I'll even do they're coming in for, I don't know, difficulty swallowing, et cetera. And they're like, oh, by the way, can you do me a quick little something on my forehead? Those lines are starting to come back.
They're starting to blur, huh?
Right. And as a mom and pop, and these are patients that I know very, very well, I am more than happy to do it. I just have to document it and make sure that everything is in properly. But
So what would you say the balance is? Are you doing
Oh,
50-50
gosh.
ENT or?
I would love to say it was 50-50. The reality is we're definitely doing, my time is more spent on the medical side. We do our own injections right now for filler. So Dr. Who and I are the only ones who fill. For the toxins, we also have our PA doing the toxins. But filler can also have disastrous results. It can, if it goes into a blood vessel, for example, you can literally necrose the face. And so there are a lot of people who are filling who really should not be filling. True story, I did have somebody one time call me. It was somebody I knew. I wasn't aware they were filling, and they called me frantically saying, I think I got into a blood vessel. I think I got into a blood vessel. And I said, it's okay. Calm down. The first thing you need to do is you need to inject a type of medication that tries to dissolve the filler. The next response is, I don't have that. And that right there says you should not be filling if you cannot deal with the complications related to filler. So filling definitely takes a higher level of knowledge, and you have to have a protocol in place should something like that happen. I am not kidding when I say it will. If it gets into a blood vessel and that blood vessel feeds the skin of the skin will die. Not to scare people at all, because it's overall, I mean, we've got techniques in place that are quite safe, but things can happen in medicine, and filling is still something, I still would tell you it's a procedure.
Well, and
you have to
I
be
think it's a
ready.
cautionary tale, right? Like I've heard of a
Absolutely.
lot of people going to Mexico to have procedures done because it's cheaper. Well,
Yes.
I think when it comes to your health, you might want to pay the extra and have it
Yes.
done by the.
I hate when I always find out, for example, somebody wants to do their lips and they tell me, oh, well, I had something injected 6 months ago elsewhere, and it often is somewhere not within the states that I can get the records, et cetera. And it's obvious it is just not okay, and trying to deal with that and figure out, and then also what you're going to be putting in may not necessarily lay correctly, but yes, cheaper is not better,
Yeah.
for sure, in this industry. And I always tell people, even in Texas especially, we are not regulated very much in terms of who can inject. So pretty much almost anyone can inject if they're under if there's a medical director who's going to sign off of it. But remember, there are still a lot of doctors who sign off on being the medical director, but they have no earthly clue what in the world is going on.
Yeah,
at
they're
the
not in the
place.
day-to-day thick of it.
No, no. And so we oftentimes have to do correction. We are trying to fix mistakes. Some of those mistakes are permanent that were done in the past by a different injector. And so it can be challenging. It can be very challenging. And it's sad because sometimes it's very disfiguring what they had done before in the past. So I do tell people, really do your research. Make sure who you're going to knows what they're doing. They've got the right licensure and accreditation, et cetera. So very important.
So speaking of that, at what point does the psychological aspect play into it? Like you see all these celebrities who have gone way overboard with some of this stuff. At what point does that ring,
That
alarm
is
bells?
a great question. So our big thing for our medical spa is really to achieve natural beauty. Natural is the word. A lot of people will inject where it's very unnatural. I really want to put an EpiPen and grab an EpiPen and stick it in there because it looks like they're having an anaphylactic reaction. But it really is to achieve natural results because this day and age, unfortunately, there's a lot that is very unnatural. Social media has played a huge role in the beauty industry, some for the positive, a lot for the negative. I have many, many patients who come in and they'll tell me, well, I saw this on TikTok. Can you do the same type of thing? Or I saw this celebrity did so-and-so. Well, you don't really know. They don't always disclose exactly what it was that they did. And same with TikTok and Instagram. I mean, social media does not portray the truth, but we look at it repeatedly, right? I mean, they have these algorithms where you're seeing the same thing over and over, and it absolutely kind of changes your way of thinking. Even with, I use the lips as a great example. There are so many events that, unfortunately, I do go around and I think, oh, that's an over injection, that's an over injection, that's an over injection. A lot of these things that we do should not be that noticeable. Nobody should say, oh, wow, you got your lips done, or, oh, wow, you filled your face. You want people to guess. You want people to say, something is different. You really look great. You really look youthful. You look refreshed. You don't want to look like that botched patient. But the problem is when all your friends are doing it too, it really, or you're seeing it on social media over and over, it starts to make you think, oh, that is
Changes
natural.
your perception of.
Absolutely.
Yeah. I like the fact that you're focusing on taking what's already there, but keeping the natural aspect
Right.
of
We
it.
just want to enhance. But what a lot of patients will come in and they'll tell me and they say, what do you think I need to have done? And I tell them, it's not up to me to tell you what you like or dislike. My definition of beauty is not the beauty. The definition of beauty is a relative word. Some people love their smile lines, and I want to keep those lines. I just tell them, you tell me what bothers you. We are taught in our training to rip a face apart. The most beautiful of faces we can rip apart, I can tell you. Again, the definition of beauty is different. That's one thing about our med spa is a little bit different too, is that we really want to also focus on ethnic faces. So being Asian American, Dr. Who also too, our PA is African American, Urena, our patient care coordinator is Latin in origin. So we really also want to enhance those type of cultural differences, and it's not a Stepford wife we're trying to create. We really want to enhance everyone's own natural beauty. And sometimes I think TikTok, there's an app out there that drives me absolutely crazy. I guess do a lot of TikTok or Instagram at all. I probably should be in this industry, but I just really don't have the time for it. But there's an app where all of a sudden it changes their face to look almost like, I think, one of the Kardashians. And that drives me crazy because that is just one definition of beauty.
Yeah.
And it's mind-blowing to me because it really affects these young women and men's minds into thinking that's what I'm supposed to look like versus looking at their own beauty and what they've got. So it's devastating.
When I like the fact that you ask them what it is they want instead of a lot of small businesses that, they try to sell.
Sure.
And it's like you're not selling anything they don't need or want. You're asking them for their input.
Yes. And I do always tell patients too, I can always do more, but even toxin, if you paralyze one muscle, it does change what you look like when you're laughing or smiling. So I say, yes, I can do that muscle that you saw being injected on TikTok, but do realize what it's going to do. So we can always add, we can't necessarily always take away. So for a new patient, I do like to be a little bit more conservative. And then you also have to have realistic goals. There are some patients who come in and they say, I want to look like Jada Pinkett Smith. It's just not going to happen that way because you don't have the same bone structure, you don't have the same ethnic background, etc. And then also some people want to achieve a look that just cannot be achieved with things such as microneedling. They really need a facelift. So Dr. Who, as being facial plastics, it's great because I can say, listen, this is really what you need. It's going to require a knife, unfortunately. I would love to say, hey, yeah, here's a microneedling package that you can do. You can do radio frequency, et cetera. But really, in the end, what they want to achieve is going to require surgery.
When it's not a haircut, right? I
Right.
mean, you're talking about more serious. It's not just, hey, I'm going to change the way my hair looks.
Absolutely. I mean, it requires being upfront and honest with them. There are some patients that, it's the medical spa world. It's a totally different world altogether. And there are sometimes when patients come in and they say, oh, well, this is my 5th med spa that I've been to. They're never giving me what it is that I want. Sometimes from the very get-go, I have to be very honest with them that I don't know if I can achieve what it is that you want because it probably is unachievable. And it's a very difficult conversation to have. And again, social media has made it hard, especially for young women. It really, really affects our own self-confidence. And sometimes I feel what I do is it's like a therapy session more than actually doing these types of treatments. We sit there for 30 minutes talking about how social media has affected them, what is their definition of beauty, can I really achieve it? And then sometimes it ends in tears. And I get it. I have a pimple on my face and I feel like everyone's staring at me. But we do need to make sure that we are also dealing with patients that have realistic views that really, sometimes I tell patients that you don't really need to see me. It may be a different type of doctor that you need to see.
Well, if you've been to 5 and you're still searching for something, then
yes.
If they go to you first and you get that brutal honesty up front, maybe that saves the other 4 trips.
Yeah, sometimes. Body dysmorphism is very real, where we can all be fixated on something, but sometimes there is a completely distorted view of ourselves that we have, and sometimes that's a totally different fix altogether.
And have you noticed your patient demographic getting younger and younger?
Yes. And no. I see the extremes, actually, which is what is interesting. TikTok and Instagram have definitely introduced younger people. There are some people who come in and, they want their lips done. They are starting to have some lines, and we talk about prevention. Some patients, and really there could be a 22-year-old that I do feel is worthy of an injection such as a toxin, and there's a 22-year-old that has a totally different skin type that really is not, and I'll tell them, come back to me in a few years. But just because they're 22, it sounds really, really young. However, there are 22-year-olds who have been in the sun. They are out there without any sun protection. Ethnically too, their skin is thicker, their lines are thicker, and we talk about doing a little bit of some low dosing just to try to prevent those lines from etching the skin and becoming more of a permanent line, kind of like the lines in your hands from putting your hand into a fist. So we're seeing those patients. We're seeing patients again from TikTok, for example. The Russian lip was really popular at one point. I don't know if it's still popular, but they're coming in wanting that. And we, again, have a discussion because the Russian lip is not necessarily a natural lip and it's not necessarily great for every face type. And then we have the other extreme. We've got the 80-year-olds who are wanting to do something more. They are wanting to focus on themselves. I think women also too, we tend to put ourselves on the back burner for a very long time and put everyone first. And there is sometimes a moment in our life where we're like, you know what? It's me first this time. I want to come in and I want to do something and I want to feel a little bit better about how I'm looking and how I'm aging, et cetera. So we're seeing young and old. We love them all. They all have something that can be done to tweak a little bit and help. Again, the goal is not to make everyone look the same. The goal is not to make everyone look like they're 18. We're working with what they're giving us.
Yeah, there's no 18-year-old left in this. So tell me about where you're located and what can I expect when I walk in? Because it sounds like you've done some really nice renovation work.
Yes, so the building has been there for quite a while. I think it's a little bit newer than this building so this building I think was built in the 70s. You guys were telling us our building was built in the 80s. Initially it was a darker building. The lighting, I called it the cave. So we recently, a couple of years ago, decided to do a big, huge overhaul, and we made it lighter and brighter and more modern. So when you walk in, you're going to walk into a great large waiting area. So because I am an otolaryngologist, I'm an ENT, that is built into the building too. But when you walk in, you go to the right, and that's going to be the door to the medical spa. And so we've carved out a separate little area for that. But we are on the corner of Texas and Blossom. We are getting some new signage also too. You can see our signage right now, but we're getting some signage on the street once we can get Webster to approve some things. Hopefully that's going to move pretty quickly. And so in either way, when you come in, you'll be greeted by our wonderful receptionists in our front desk, and they can lead them and show them where they need to go.
So as a med spa, does it kind of have some of the feel of a day spa, but with medical kind of supervision?
I wouldn't say necessarily. Yes and no. It is kind of more of a service industry. It's not going to be the same feeling as if you see me in the medical side, for sure.
Yeah.
So you go in and you've got snacks and you've got coffee and you've got a pretty rug and there's a pretty couch. I hate to say it, guys, you're not going to get that on the ENT side. So it has that feel, but as soon as you go back, there's definitely a difference in terms of things that you're going to get. Yeah, absolutely. So it's prettier. Absolutely. When you're dealing with mucus and things of that nature on the ENT side, we're not going to have velvet couches. It's just not going to happen. Things are going to be very sterile and very easy to wipe down. But as soon as you walk into the rooms are still going to be. It's medical grade products, again, medical grade procedures. So unfortunately, it has a little bit of the initial feel of a day spa, but then once you go in, you'll see it's different.
So obviously most of your patients are probably female, but are you seeing a rise in the number of male patients, and what types of services are they looking for?
We are. Women tend to be very vocal about what it is that we do. So if one person says, hey, I got my toxin, look at it, looks great, what do you think? You guys should go and do it. Men are very secretive about it. But that doesn't mean that they don't want it. To give you an example, I had some toxin, and my husband is Persian. He's got some very, 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 I call it the Grand Canyon across his forehead. And I said, Alex, I'm injecting that. And he's like, no, I don't want it. I said, this stuff is liquid gold. People would love to have it, and I'm injecting into your face. I did it. And now every 3 months he comes to me. He's like, look at my forehead. It's starting to move again. I think I need a little bit more of that. So you realize, and they realize too, men are just as vain as women. I mean, men don't want to age either. So they are coming in and saying, my wife is looking younger, and I feel that I'm just getting older and older and older. What can I do to look a little more refreshed? The same things that women want. And I'll talk to them about toxin and facials. One thing that men aren't as used to doing is having a regimen. And I do tell people, my esthetician is going to touch your face once every 3 months, but you are going to have to touch your face every single day, making sure that you're wearing sunscreen. Men don't tend to do that at all. They don't have a 4-step process in the morning or at night when they're going to bed. So even for my own husband, I have him on a little bit of a regimen just to help. So we always talk about the skincare too. Hair loss, that's something that actually applies to both men and women. Women lose their hair, and it's sometimes even more devastating for women just from a social standpoint. So they come in wanting to talk about that. And so we have a really wonderful exosome treatment that we give for men and for hair loss and for women too. But toxin has really picked up with men. And you would be amazed. I mean, look around at some of your friends. They actually probably do something too, and you don't realize
I know a couple
it.
of them that I could probably see doing that stuff.
Right,
so.
right. And I don't think it's something that men should be embarrassed about by any means whatsoever. I know it may not be as socially accepted, but it is definitely picking up traction.
I think over the years, guys have been doing a lot of things to make themselves look prettier.
Yes.
I mean when they do nails now, they do
very true. I mean, men spend a ton of money, for example, on vitamins and creatine and all of that. So they want to look good. But what people always see is they see your face. I mean, it really the face is something they're starting to focus on. They want to have a trim waist, etc. But they are now realizing that, hey, I think I got to do a little bit more.
Yeah. So we're going to do a quick FAQ. Insurance. What types of insurance do you take? What kind of procedures would be covered and which wouldn't be?
So as a med spa, it's not covered by insurance.
Okay.
On the ENT side, it is.
Fully covered on the ENT. So med spa, you're on your own, same as you would be.
It would be great if it could be covered, but unfortunately, they're not going to pay for your toxin.
But would there be any conditions that might somehow be covered?
Unfortunately, on the medical spa side, there really are there's nothing that's going to be covered. Now, if you're wanting to do, for example, a surgery, there are certain types of surgeries that sometimes can be covered, such as a functional septorhino. I know that doesn't mean very much, but really that's when we're going to move you over to the medical side.
So, and because obviously beauty costs, and so, I mean, insurance is
doesn't care about your beauty.
Right. So, top 5 procedures that you guys do, top 5 things you do on the med spa side.
Okay, so we've got our esthetician and then we've got the providers. So as providers, it's really going to be filler and toxin that we're doing all day long. And then really we're gaining traction a lot with the exosome procedures for the hair restoration. On the esthetician side, she is doing a lot of facials that incorporate those medical grade products that we were talking about. So she may add on a peel. That's a deeper type of peel. Microneedling also is something that's quite popular. And there are 2 types of microneedling. There's regular microneedling and there's something called radiofrequency microneedling that we can talk about later on too. So those are probably the top procedures.
Okay. And how do people find you other than your physical location?
So you can go to our website at CL Med Spa, CL for Clear Lake, clmedspa.com. And you can go to our website and it's got all the information. Also, you can find us on Instagram and Facebook.
So you do Instagram.
Well, let me make it very clear.
Somebody does Instagram.
Somebody does it. They tell us what is trending and what's popular. And I do the dance. I do the impersonation. It's not my favorite thing to do. And it takes me a gazillion times to do it. My PA, who is young and is very familiar with this, can do this in 2 seconds. It takes Dr. Who and I, it's like an all-day process. I think it was harder than residency to learn these TikTok things.
Well, it's been a pleasure having you on.
Thank you so much. Appreciate it.